What we can share is that is from over the last few months with the total of 92 cases. However, besides that cluster that we had earlier in the spring, the majority of those are from recent. So the end of June, first part of July. And if you look at some of the data of what we've sequenced so far at the end of June and first part of July, the majority of those sequences are the Delta variant. You know, why we have 92, it's more of it gives us an indication of where that geographical spread, or if we're seeing increases in cases with this particular variant versus another variant in the area. So while we feel confident that we're getting the total number of positive cases for areas, you know, and we're working with our laboratories and hospitals to encourage them to send specimens for variant testing. Not every single test that's positive is going to be sequenced at the public health lab. So it's a surveillance number. Likely there's more than 92 cases of Delta variant in the state. Again, these are just of the ones that we've sequenced and that we've received, and we're certainly working with our partners to get a wider range of the number of specimens that we've received so we can get a better estimate of what might be out there.
I can tell you we don't get all the negatives, and that affects, you know, our percent positivity. It will falsely elevate the percent positivity, because if you don't have that full denominator, you're not really going to know what that is. With our numbers being as low as they have been, that really hasn't had an effect on things. If things start to move up again and we need to start really closely monitoring that, then we may have to re-look into different abilities that we would have to be able to enforce that. We are looking at, as Jolie spoke about earlier, with the variants, as far as getting positive samples sent to us. We have had a good increase, but we don't have a good sampling throughout, you know, all the regions of the state. And so we are currently looking at the promulgation of some rules in order to get a certain percentage of all positives from every lab in the state sent to us, so that we can do more complete sequencing for surveillance.